We know what works in terms of keeping populations healthy. I'll give you some good examples, but let's go back to the early 1900s. Late 1800s, early 1900s, people died in droves from any infection could kill people, especially in, crowded city centers where there was a lot of sewage. Sewage wasn't being treated. There wasn't fresh water. Water was contaminated. The most common reason people died in this country and in most countries was diarrhea. Diarrhea was like the number one cause of death. But if you look at the graphs, the statistics on mortality rates and what they were from, especially infectious disease or just mortality rates in general, scurvy was on top of the list, and it was the same rate of disease and declined at the same rate as tuberculosis, cholera, scarlet fever, yellow fever, pertussis, measles. People died from all these infections, but they died from scurvy at the same rate. Once the death rate from scurvy started dropping, we see all these infectious diseases dropping at the same rate. But what else was going on at the time? So why aren't people dying from scurvy anymore? Well, we have trucking, we have railroads, we're getting produce, lemons and limes in the winter. So people aren't dying of scurvy in the middle of the winter and dying from other diseases because they don't have adequate vitamin C. We also have sewage treatment, having water that's not going to give you diarrhea, so you're not constantly being bombarded with infectious agents. So all these things, in this country, we did not vaccinate away cholera, we didn't vaccinate away tuberculosis. There were sanitariums in the 20s and 30s, even the 40s from tuberculosis. We didn't vaccinate that away. So there's a lot of things that people think of that we vaccinated away, but we never did in this country. It was all actually changes and improvements in public health in just sanitation and water and nutrition. And that's really what we need. So I was in Haiti several times after the quake, and I was there the last time for the cholera response. What happened politically for the cholera response was very interesting because we saw a big push for cholera vaccination to vaccinate away cholera. Now, that makes no sense. We're talking about a population where there's not adequate sewage. There's not any sewage. And if you look at that area, they're cleaning their water in the river that's loaded with cholera. They were using that water for drinking, for cooking. The money spent on the cholera vaccine, they weren't cleaning up the river. They weren't bringing fresh water or clean water treatments to the area. The money would be better spent with normal, just public health measures. That's what makes sense. So what we know is that people with adequate vitamin D all winter don't suffer at the same way that people who don't have adequate vitamin D all winter suffer from upper respiratory infections of all kinds. We know that vitamin D is very important for respiratory infections and immune function in general. So really better measures would be nutritional measures, making sure that areas that have a lot of problems with illness, like third world areas, like Haiti, for instance, that there's adequate nutrition, in their case, it's really the water and the sewage that's the issue. But people like to attribute the reduction in mortality rates from infectious diseases to vaccination, but in fact, that's not the case. And all these things that we do use vaccinations for, the morbidity and mortality rates were already low. They were already where they are now. The mortality rates were already flat before we introduced the vaccinations. I'm talking about looking at statistics from the government of England, Australia, Canada, the United States, medical graphs that were official graphs. So if you look at them, you'll see that the mortality rates were where they are now prior to the introduction of vaccination.